Zoals gezegd ga ik even een introductie geven. En ik begin even te refereren aan een meeting die ik deze week had met een heel aantal partijen die zorgaanbieder zijn, maar ook die in de IT en business om de zorg heen opereren. En het onderwerp van de bijeenkomst was cloud computing in de zorg, zoals u kunt zien. De eerste vraag die daar natuurlijk op tafel komt is: waarom zou je zoiets eigenlijk willen? Waarom zou je dat doen? Dus wat zien wij in de markt, wat het nodig maakt om een vertegenwoordiging in de cloud technologie te gebruiken in de zorg en meer in speciaal in de research in de zorg? Wij zien uiteraard een groeiende behoefte aan een plek waar data veilig en schaalbaar en natuurlijk ook kostefficiënt opgeslagen kan worden. En wij zien ook een behoefte aan de vrijheid om te gebruiken wat er inmiddels voor analyse van dat soort zaken beschikbaar is. De medische onderzoekers die op grote schaal onderzoek willen doen, hebben daar ook een platform voor nodig om dat te kunnen uitwisselen en te kunnen gebruiken. Wat is nou de beste strategie voor een partij die in de zorg ook wil gaan werken? Je hebt om te beginnen natuurlijk de visie nodig dat je dat wil gaan doen. Je hebt een betrouwbare cloudpartner nodig. Je hebt aandacht nodig voor verandermanagement. Je hebt natuurlijk ook aandacht nodig voor de regelgeving die daar van toepassing is. En je moet de waarde kunnen begrijpen van wat er te krijgen is. En dat hopen wij vandaag aan jullie te kunnen laten zien. Als we dan even verder gaan naar het medische onderzoek. Dan is het even de vraag van: herkent u deze aandachtspunten? De onzekerheid over security en privacy. Iedere discussie die je daarover hebt, als je het hebt over het aanbieden van toepassingen in de cloud, dan gaat het gelijk over: ja, maar dat kan niet. Er zijn ook partijen die het gewoon doen. En dat laat maar weer zien dat het wel kan. Je hebt ook eisen vanuit financiers van onderzoek. Dat komt steeds vaker voor. Reporting. Dus mensen willen zeker weten dat wat je doet geborgd is. Dat er een data trail is. Integratie van researchbronnen. Je wilt niet laten liggen wat er is. Repliceerbaar onderzoek maken. En vooral ook je time to market. Dus de tijd die je nodig hebt om jouw researchbronnen bij elkaar te zoeken. Approval te krijgen. En je hele omgeving op te zetten om dat terug te brengen. Want je wil bezig zijn met je eigen onderzoek. Verder wil je uiteraard meegaan in de innovaties die er zijn in de markt. En dat blijkt lang niet altijd zo eenvoudig te zijn. Er is veel beschikbaar, maar zie het maar eens bruikbaar te maken. En dat geeft een stress op de IT-omgeving en dat geeft kostbare investeringen. En daar komt om de hoek kijken dat het nuttig is en dat het zinvol is om naar cloud-toepassingen van research te gaan kijken. Daarmee introduceren wij bij deze de Vancis Research as a Service platform. Wij doen dat heel nadrukkelijk met partners. Vancis, voor u die het misschien niet weet, wij zijn ontstaan uit SARA, tegenwoordig Surf SARA. Wij zijn dan ook onderdeel van de Surf-organisatie. Vancis is een IT-partij die infrastructuur aanbiedt, die een safe haven van data aanbiedt. Partners voor het platform zijn Aridhia en Mgrid. Mgrid biedt de technologie om de data beschikbaar te krijgen die uit klinische en andere systemen komt en bruikbaar te maken voor onderzoek. Aridhia heeft het platform gebouwd wat in de UK al draait, waarmee researchers aan de slag kunnen. Snel aan de slag en veilig aan de slag. Daar gaat Chris straks alles over vertellen. En verder hebben we kennispartners, CareIQ, Portavita en Xomnia, die de kennis en de ervaring hebben om het omgaan met data ook een plek te geven. Om kort te zijn, wij hebben een Research as a Service, een clouddienst voor big medical data, bruikbaar en toepasbaar te maken voor onderzoekers. Het biedt een werkruimte en het biedt een dataopslagruimte om te samen te werken en om gegevens en applicaties te integreren. Nou, ik vind dat ik er genoeg over gezegd heb zover. Het is een stuk interessanter om te kijken naar wat Chris Roche erover te vertellen heeft. Hoe het systeem werkt en wat het doet. En vervolgens hebben wij ook nog een van de partijen die daadwerkelijk mee aan de slag is. Die gaat laten zien wat ze ermee doen.
So I'm Chris Roche. I've come over from Edinburgh today to help our partners Vancis launch our research as a service in the Netherlands. And it's really interesting. When you look at the market, there are two current business models that are dominating the data market at the moment. One of those is the long-tail business model. Anybody familiar with the long-tail business model? Yeah, good. So if you're not and you're in healthcare research, you should get very, very familiar with this very quickly. Because what this model says is that for years and years and years and years and years, we sold a few products to lots of people. Now what we want to do is sell just a few products to many people. Example of that would be if I go to my local cinema, there's maybe 10 films on. There's never a horse racing film on, and I like my horse racing. Never a horse racing film on. But now I can go to Netflix and choose any film I like that is personalized to me, and they will charge me a premium for that. And this business model is driven by data, and you're starting to see this business model in healthcare. This is where healthcare is moving, to what we call the long-tail business model. Whether we're taking data in from bedside monitors, brain scan images, or whether we're taking genomic data in, which our platform will take all in, what that's meaning is that we are driving one of these personalized business model. If I can digitize the human being, then I can make a very specific drug or a very specific treatment or a very specific decision around that person. So the experts at these models are the people like Google and Amazon. They've been bringing these models into various industries, marketing, finance, for the last few years. The other business model that you will see everywhere is this one called crowd-accelerated innovation, which is how do you use collaboration to accelerate what you're doing? And you see this everywhere in healthcare. This is one of the projects that we underpin the platform, and a number of the medical universities here in the Netherlands are part of. And this is the European Alzheimer's project, where we're taking data in from all the Alzheimer's patients across Europe. We want to look at that data and then run clinical trials, and more importantly, run adaptive clinical trials on that data. Now, that can only happen if you work in collaboration and you bring in every type of data. So it's both a long-tail model and a collaborative model. So these business models will be all everywhere you go. Any pharmaceutical, life science company will have collaborations. Universities now, if you want to get any funding, you're going to have to collaborate across how many countries for Horizon 2020 funding, minimum 3, maybe 10, maybe 20. How do you bring data in from all those systems? Because some of the challenges you have in healthcare when you try to bring those two business models together is that you're trying to balance collaboration with reproducibility. How do I get reproducible research? How do I do that in this environment? And actually, how do I audit that and make sure all the data is safe? And so how do I bring collaboration and not giving access to the data or make it... Well, they're two opposing forces that you're trying to bring together. So we thought, well, let's put the audit bit to one side, but how did Google and Amazon approach this technology-wise when they did this for other industries? And one of the things they did, they said, we're not going to look at the standard data structures that you've used for years and years and years, the last 30 years. What we'll do is we'll start creating lakes of data, or some people call them data landing zones, some people call them safe havens, some people call them oceans. What we'll do, we'll just put all our data in, And when we're ready, we'll build the model that we need to build on that data. And what they also said is that we're actually going to use the technology differently. We're going to use virtual and cloud-based infrastructure, like that comes from our partners in Vancis. And we're going to have different ways of building applications on top of that. We're going to use different frameworks, and we're going to use different ways of accessing that data. So we said to ourselves, what if I could take all those technology techniques, but add in collaboration and add in the ability to audit around that data and get a comprehensive audit, brought those all together where you could have your data as the center of gravity, invite all your people to the data, give them all the tools they want to work on, serve it back to them, all audit, and do it in a subscription model which drives the cost of consumption down. So you're spending more money on the science and less money on the infrastructure. So when I give you a £20 million grant, you're not building a building or a data center, you're only spending 500,000 on that, and the other 19 million has been spent on the science. So that's what we did. We built Analytics Agility. To do that, we built that with money from Cancer Research in England, and we built it from a genomics program that we were working on in Scotland as well. And so what that allows you to do is bring all your data together, regardless of the data type, into one of these lakes, which in the Netherlands would be inside Vancis. It allows you to invite all your multidisciplinary team together to work on that data and then deliver solutions back how you want. That's interesting. This is just an example of one of the solutions we've delivered recently, and this is a consolidation of cancer centres across the north of London, where they decided they would consolidate cancer care from 15 different centres. But when you do that, all the data has to come in. So the data's coming in from 15 different hospitals, all on different systems. Nobody knows what's happening. So we took all the data into a lake. We run analytics as we took it out of the lake, and then placed the patient on the right path of the pathway. So now the multidisciplinary team can all come together, no matter where they are in the world or the country, look at that at their multidisciplinary team meeting, and then say, we need to treat this patient, we need to treat that patient. Another example, which is one Netherlands-based, is we're working with Philips. We're taking data of critically injured patients in the ICU, and we're trying to build a predictive model that will predict intracranial pressure so that they can be treated in the ICU. So we've taken and the issue is you're taking high-frequency data, and lots of it, and you're trying to map that with low-frequency patient data. So we brought that all into the model. That used to take them 48 hours to run the model, which is a bit long if you're an ICU patient. So what we're now doing is we're taking all that data in. We've got the algorithm down to a few minutes now, and then we'll build the algorithm back out through the bedside monitor so that the clinician can run that at the bedside. And the only reason we can do that is because we're using a data lake model where then all the data scientists and the clinicians have then built the algorithm they want, and then we're releasing it back out in an agile manner. In this case, it's not going to be through a mobile phone, it's going to be through a bedside monitor. But whichever device you want, doesn't really matter. At this point, I'm going to ask Anita to come up to the stage because I want to talk about another project that actually includes the Netherlands as well. And this is a European-funded project, Horizon 2020, which is bringing data from, I think it's 6 countries and 10 organizations together.
Yeah.
But I'll let Anita talk about that project.
Okay, thank you. So, if we talk about tooth decay, and it may not be something that's as exciting as talking about cancer or potentially important for people, but what people probably don't realise that it's it's the most common chronic disease worldwide, and it costs the EU about almost £80 billion a year to treat. Severe gum disease is a prevalent condition worldwide, but it is largely preventable. And it also very closely relates to diet and nutrition. And the current systems for treating it, even though it might be a very simple, have your teeth filled and drilled and filled, it is very diverse and fragmented in the way that it's organised and that the data is recorded. So I'm involved now, and fairly recently been involved in a project called Advocate. And that's a very prestigious funding stream from the EU Horizon 2020. And the Horizon 2020 supports its excellence and impact. And it supports excellent science and industrial leadership and changing things. So it's about society change. So the important things, it's about linking science and making things workable in industry. And this project is coordinated in the University of Leeds by Professor Wilton, who I work for. So the project is a collaboration between the universities, healthcare providers, health insurance companies, patients, the public and data experts. And in this case, the data experts that we're using are Aridhia. And we want to create evidence-informed new healthcare model for, in this case, oral health, which was considered to be a simpler model than some of the more complex healthcare conditions. So we want to promote disease prevention. And in short, we want to collect big data and we want to make a difference. We want to change behaviors, and that's the difficult thing to work on. So we use the phrase interdisciplinary stakeholder ecosystem, which we quite like. And it's about collecting qualitative and quantitative data from patient organisations. So they input their views, and from the health practitioners themselves who can see the problems with changing pathways and barriers. So we want to move from towards a more preventative model, and this is the same in all healthcare. It's moving to a preventative model rather than necessarily treating the symptoms, which obviously are important as well. We're working with insurers to supply data. We've got 8 data sources around the EU, coming from 6 different countries, which again, it presents its own problems to deal with. We're working with oral health consumer products, for example, toothpaste manufacturers, and the universities where we're guiding and doing the research and the analysis. And it will all, we hope, make a paradigm shift in care, and that's really important. So these are the areas, briefly, that it comes from NHS England, from Leeds, from Ireland, from the Netherlands, Denmark, Germany, and Hungary as well. And most importantly, from our friends at Aridhia. So they've provided the platform that Chris has just explained. This is going to provide a dashboard that people can use. We will provide a set of indicators that people can do comparisons. We set benchmark performances so that dental practices themselves can compare how they work with other, how they compare to their changing their models from drilling people's teeth to the new preventive model. And we're also going to have an engagement app which the patients will use and record their data as well, so we can pick up that valuable data too. So what we're hoping to do is blaze a trail so that big data can then be used for other healthcare products and on more complex healthcare systems, and also ultimately to influence the policymakers. So this is about working out how it works in real life and then making it happen and then spreading that amongst other disease areas. Okay, thank you.
Okay, thank you very much, Anita. Okay, so we will back about 15 minutes, and a big applause for the presenters here. Thank you.